This new law requiring or mandating imaging institutions to inform patients of their breast density came about a year ago. So at that time, patients weren't really sure what breast density was all about, but now that we've had a whole year of women getting their mammograms, they all have questions. Well, I've got dense breasts, what do I do about it? So now we're struggling with, how do we deal with these patients?
The first step is understanding why this law exists.
Breast density is important because when you're looking at a mammogram, you're looking at black and white, right? Now, cancers tend to be white. When your breast density is high, then you have a white background. So you're kind of looking for a snowball in a snowstorm. You're looking for something white on white. It's very difficult to do, and you can miss things.
While denser breasts may make it harder to find cancer, it's important to know that this isn't a sign of cancer.
It's really all genetic, everybody is built differently. Our breasts are built differently. Some have a greater content of fat, and others have a greater content of glandular tissue. So they're all mixed together in anybody, and it's a broad spectrum of what kind of breast tissue you may have. And it's not necessarily a bad thing. Typically, young people tend to have more glandular dense breasts. As we get older, our breasts get replaced more and more with fat, which makes them lower density. So it's not a bad thing. There's not a right or a wrong way to be built. It's just that we just have to make accommodations in case we do have very dense breasts.
New York State requires all patients to be notified of any issues pertaining to breast density. However, currently only patients with a high risk of cancer will require further screening.
If we know that the patient has a very, very strong family history of breast cancer and they have these dense breasts, then we might go ahead right then and say, let's do the ultrasound now. If we see something a little funny about their dense breast, if it looks nodular, if I'm afraid that there might be something underneath that dense tissue, then I will immediately send the patient for ultrasonography. Ultrasonography is using sound waves. It's no radiation at all, so it's a very good way to get a second look at your breast tissue. It's very good at telling the difference between cystic masses and solid masses, which mammography is not good at. So it's a very good supplementary screening tool to look at women with dense breasts.
And for most, these tests and screening are strictly a preventative measure.
I think most people are not going to develop breast cancer. That's one thing. The next thing that we tell them is that they're doing the right thing. They're getting screened every year, and that's the best that they can do to detect early breast cancer.